Coming to you live from Gayaza, and I'm speaking to none other than Dr. Moses Mulumba. Like you clearly said, patients are stranded in hospitals. Some have decided to abandon hospitals currently because of the nationwide stockout of drugs. Dr. Moses, nice having you this morning. Who is to blame in the current crisis?
Thank you so much, and good morning, viewers. I think that before we get to the blame, it's a shame to the country that we are talking about a public health system that has been struggling over the years. And as it tries to build its confidence post-COVID-19, we are now getting into a crisis where people are not receiving medicines, the most essential medicines. We are not talking about sophisticated medicines, including medications like HIV/AIDS. And the implication of that is that, people become resistant if they cannot continue with their treatments. So it's not something that's not predictable, because you can predict how much medicine you need to provide. So when I was listening to the Minister of Health making a statement and the helplessness that the Minister of Health is going through and the Minister of Finance responding, I kept wondering whether one is in the private sector and another is in the public sector. So the harmony that is lacking in ensuring that we deliver medicines, the most essential medicines, to the population is something that we should be ashamed about as a country. We are not financing medicines 100%. What we are actually asking for is the 16% which the government finances, because the people continue to finance medicines up to 50% out of pocket. Okay. And the 34% is coming from donors. But we are also talking about where the donor money goes when it comes to medicines, if it cannot be able to reach the NMS model. If you know, historically, we had the central medical stores, which were managed by the Ministry of Health. Okay. And we had these inefficiencies. So there was a proposal to move from the central medical stores to the national medical stores. Okay. And the thinking at the moment was that we will not have this kind of crisis that we have. But the national medical stores has created a situation where it's now like an independent entity from the rest of government, which shouldn't be the case, because we anticipate that through the boards, through the governance structures, these people are able to work and deal with the governance issue on delivery of medicines. So it is very absurd that they cannot have internal meetings to actually discuss. Even if they were to introduce a new system of payment, a new system of requisition, we people on the outside should not know the dynamics of how this system is going to be working, because they should test it. There should be implications understood on the equity or inequity issues that are going to raise out of lack of medicines. We can no longer have the excuse of COVID-19 and Ebola, because these are crises that have come. They have destabilized the way things are working. But we've had a lot of time during the Ebola time to do things much better, and we are not doing better. As a result, the patients that are used to receiving their HIV/AIDS medications are not receiving. Malaria remains as one of the top killers in this country. Yeah. And it's killing children. So we shouldn't have a crisis. We shouldn't have a stopgap on supply of these, because the system, the government system, is clogging itself. And it's a fight of egos between those that have powers to release money and those that have powers to be procuring medicines. I think there is nothing that they are trying to prove, because they are playing on people's lives, and this is something that should be challenged and should be changed.
What does this reveal to the system? National Medical Stores says they have drugs, but they have no transport to transport it to the different locations where these hospitals and the patients are. What does this reveal to the system?
It shows inefficiency. It comes back to inefficiency. I know in most cases we've talked about privatizing things, but there are things we can't privatize all the time. The creation of the national medical stores was to run away from the inefficiency of the way the public health system works. If national medical store cannot have buffers, cannot have a stock, cannot have resources to be able to transport, then we have cured nothing. Just look at the models that the joint medical stores is using on the supply of the medicines. What lessons do we pick? Are we going to have a situation where every public health entity is failing to perform and we always come back to the same thing? We have this thing in the supply of blood. We have it almost everywhere. And I think that for me, as I was seeing Parliament having a conversation on this, the Deputy Speaker picking up this, it is an important conversation, but they need to unblock where the real problem is, because they own the resources, the Ugandans have paid the taxes, the money is actually there. The question is on priority. The question is on priority, and things need to change.
You're a health activist, and you've seen what is happening. Hospitals have gone like 2 to 3 months. Some have gone 1 month. What does this reveal to the health indices that we fought for long to reach where we are?
I want to tell you that the stockout that we are currently facing is going to change the statistics for next year. We are going to see more people coming, more deaths that we are realizing. Before we know it, it's going to jump to maternal health. The mothers that are supposed to be delivering, we are going to receive more mothers dying within the healthcare setting. And this is not good for performance of a public health system. We cannot run our health system purely under private. We cannot even give it the current 50% that we have given. I think we need to reclaim back the performance of the public health system. And reclaiming back the performance of the public health system is to deal with these very issues that we are talking about. Okay. We are paying public servants, we are paying people in NMS to be delivering. I think that their failure to deliver is a question that one needs to pick interest in. And the commission of inquiry needs to actually be put in place. And lasting solutions have to be thought about in the way things are being delivered. Medicines are not shoes that I will walk barefooted if I don't have shoes. You lose lives if people are not receiving medicines. Tuberculosis, for instance, if people are on treatment and they default on treatment, the resistance on tuberculosis and what it causes to the health system is a real crisis that we need to deal with. And these are things that Uganda should not cry about asking for aid from outside. These are things that we need to deal with at a national level and make sure that our systems work. The outside countries that are giving us support will only come in to support things that we have tried as much as possible. But the current situation is actually showing that we are failing in governance. In governance, not just political governance, but governance of the health system. And we are not triggering things we're supposed to be doing right, which are currently missing.
Maybe as we await for the report from the Prime Minister, because she's coming back to Parliament to present, what needs to be done in this current stockout and a more lasting solution?
I have never found a situation where they say they cannot elect an MP who has died. The same place they get that money should be the place where crisis money is got. Currently, globally, they are discussing a pandemic treaty. Pandemic treaty, some of the provisions which are being discussed are on how do we deal with a crisis like that. There should be resources which are allocated. I think as they try to deal with the system issues, we should have a crisis fund that actually enables the delivery of medicines to be happening. We are not going to have a lasting solution now because these are system issues sometimes which they have taken long to see, and now the reality is setting in. The Minister of Finance needs to move out of the finance thinking and think about public health and create a crisis fund and deal with some of these things which are missing. But the NMS also needs to come out very, very clearly and communicate to the public. At the moment, the only communication we are seeing in this situation is before Parliament. There has not been public accountability. There has not been public statements on what communities need to do when they lack medicines. Are there alternatives that people need to think about? Okay. If, for instance, we cannot find medicines in one facility, are there facilities where we can find medicines? How do we work with the community health extension workers in a crisis like this? Because if people cannot find the medicines and we are able to deliver them within the communities, can we work with them much more than we've been working? So I think that a crisis fund is possible to have in this country. And we need to deal with this issue as a real crisis and move away from the current shame that we have.
Thank you very much, Dr. Moses Mulumba, here at Hafya na Haki. But Simon, just like any other person out there, like you do your job, imagine a doctor or a nurse that is going to walk into this facility. Patients are there, but they have to do nothing to them. No diagnostic material to use in this situation. My name is Henry Mugenyi. Back to you at the political